Okay, guys, let's jump into chapter 20 and go over the lymphatic system. All right, I'm going to start by doing a heads up warning. This table 21, which is actually, I duplicated it here, but it's at the end of the chapter. It goes over the different types of lymphatic organs we have and tissues that we have. Know this table. I will be drawing questions off this table. All right, now that we've got that out of the way, let's back to our previous messaging. Understanding the structure and function of lymph nodes will let you evaluate a patient for signs of infection. Whenever you go to the doctor and they're like palpating, they're feeling to see if they feel any swelling. The reason why is they're trying to see if you have the lymph nodes making the swelling, as they're making large numbers of white blood cells to fight an infection. So that's what they're looking for. Anyway, but there's a little video coming up like there always is. I'm about to play that. So take a look here. Okay, so let's continue here. The lymphatic system, I've already told you when we talked about circulatory, you remember the hydrostatic pressure pushes the fluid out of the blood into the interstitial fluid, the fluid around the cells. And you know that as you get down towards the other end of the capillary bed, the colloid osmotic pressure will draw the most of the fluid back in, but not all of it. Well, to avoid having you then fill up with that excess fluid that's not drawn back into the blood, you have to drain it off somehow. And I've told you before, the lymphatic system drains that lymph, that interstitial fluid, off of the tissues and puts it back in the blood. So that's one of the functions. That's the non-immune function. So fluid that leaked out of the blood vessels and became part of the interstitial fluid around there, you're going to bring it back. And we have three parts. We have the lymphatic vessels, we have the lymph, that's the fluid, that's what we call that interstitial fluid. As soon as it goes from the tissues into the lymph capillary, we now call it we call it lymph. We change its name just based on the location. And then we have the lymph nodes, which are there to clean the lymph, to look for any bacteria or things in it that don't belong and destroy it. So lymphatic organs, lymphatic tissues, they give a place for the immune system to have phagocytic cells, cells that eat invaders, and lymphocytes, white blood cells. You remember, never let monkeys eat bananas. The second most common of the white blood cell types. This is where This is where we have them. We have large numbers in the lymph nodes. So let's see. So what type of lymphatic organs we have? The spleen, the thymus, the tonsils, the lymph nodes, other lymphatic tissues. Let's move on. Okay. So the lymphatic system returns this interstitial fluid and leaked plasma proteins back to the blood through the lymphatic vessels. When it says plasma proteins, I want to make it clear you shouldn't have much of that going on because most of the plasma proteins stay in the blood. But yeah, if some of it leaks out, that's going to come back through the lymph too. About 3 liters of that fluid is returned to your blood, drained off the tissues and returned to the blood every day. And as soon as the fluid goes into the lymphatic system, into the lymph capillaries, we're going to call it lymph. We're going to stop calling it interstitial fluid. All right, so lymphatic vessels are one way. You might one way. What are they talking about? They actually are closed on the end. Here's a nice picture. I know I jumped ahead a little, but we'll go back. But they are closed on one end. The lymph can only go in one direction. And then we'll talk about this more, but you see this cell right here making up the lining, the endothelial cell. It should be the lining. It's the whole vessel in a lymph node, but this cell making up the wall, flap-like mini valve. What are they talking about? What they're talking about is that this end is attached by fibers to the surrounding tissue, and the other end here is floating free. So you have this. Let me turn it so it looks like the book. Yeah, same angle. Actually, they're doing it from the inside. So yeah, there we have that flap right there. Well, it's only attached at the end where my wrist is. The other end of my hand can move. Same thing. If pressure builds up in the interstitial fluid, that's a valve. Fluid can flow into the lymph, into the lymph capillary, and then when pressure builds up in the lymph capillary, that shuts. It traps the fluid that came in. It keeps it in. So that's the flap-like mini valve. We'll talk about that when we get to it. All right. But when they say that these are one directional, let's see. Yeah, here we are. Okay, when they say they are one directional, one way, that's how fluid can go in, but it can't come out, and it's closed on one end, so it can only go the other direction. The reason why is we're trying to carry that lymph back to the actually up here where the carotids and the jugular vein are together, and then we're going to return right there into the bloodstream. So the lymphatics includes lymph capillaries and the larger lymphatic vessels. Lymph capillaries are blind-ended. That's the fancy way of saying the one end. I would call it dead-ended, but whatever. They go between tissue cells and blood capillaries. We don't have lymphatic capillaries in bones, teeth, or bone marrow. Uh, there's a little bit in the central nervous system. We didn't used to think there was any, but it makes sense if you don't want to build up too much fluid in the central nervous system. So there are a few spots where we can drain excess interstitial fluid and extra central nervous cerebrospinal fluid off in the same thing and dump it into the blood. Okay, moving on. Lymphatic capillaries, they're like blood capillaries. What they mean by that is they're just endothelial cells. They're just the one layer. Where it says but more permeable, that's because every cell is a valve that can move to allow lymph in and then close to keep the lymph in so it can't escape. So remember with capillaries, and this is true whether we have continuous ones, fenestrated ones, or sinusoidal ones. With capillaries, the cell, the endothelial cell, doesn't actually move out of the way to let big things get through. That's the kind of thing they're talking about. So what can get into the lymphatic vessels? It can take bigger molecules and particles that the blood can't. You know why? We already said it. Meaning plasma proteins, cell debris, pathogens. We're talking like invading bacteria. Cancerous cells. Say, oh crap about that because that's bad. You don't want cancerous cells in the lymphatic system. That's why if someone has cancer, one of the first things they do is remove the lymph nodes, the obvious, easy to get to ones. I say that because there's lymphatic tissue everywhere in every organ and almost every organ, and a lot of it is something we're about to talk about called malt, where it's super tiny and it doesn't have good capsules around. It would be practically impossible to remove all of the lymphatic tissue, but you try to get anything that you think might be swollen with cancer cells. So anyway, this can act as a route for pathogens or cancer cells to go through the body. That's what we were just talking about. But it also is an area where you have lots and lots of lymphocytes that will hunt and eat and destroy pathogens. So, on the whole, I think it's better. It's a good source of immune system. It's just something we have to be worried about a lot with cancer. Moving on. All right, there's the pretty picture. We have the schematic, and then we have an actual diagram that's a lot nicer. But you understand that what we are doing is taking fluid that stayed in the tissues, did not go back into the capillaries, and we're going to collect it with the lymphatic system, and we're going to return it to the blood on the venous side near the heart. Why the venous side? Because it's so much lower pressure. If you had the almost no pressure lymphatic system trying to empty into an artery, it would have blood squirting into the lymphatic system because the arteries are so much more powerful. So we go for the venous side because of the lower pressure. All right, so lymph capillaries, they have a lot more permeability than blood capillaries. You already heard that. Due to two specialized structures. One, the endothelial cells overlap loosely to form one-way mini valves. There's the picture again. You remember, attached at the wrist side, not attached to the other side. So this endothelial cell can swing out of the way, let huge things in. Then pressure builds in the lymph capillary, snaps shut. All right. So there are two specialized features. The endothelial cells make these mini valves. The mini valves are anchored by collagen fibers to the matrix on one end. Extracellular fluid volume will open the mini valves even more. Decreases in extracellular fluid cause the mini valves to close. We already talked about that. In fact, I'll jump ahead. We'll get to it, but all the things that you've seen in the venous system of blood, you're going to see the same things here, where you're going to have one-way valves made out of the endothelium that keep things moving up, where you have the respiratory pump and the muscular pump squeezing the vessel to move the fluid up. Same thing is happening here, and it's even more important here because you've got zero pressure from the heart. All right. We also have lacteals here. Lacteals are special lymph capillaries that we have in the intestine. They absorb digested fat and fatty lymph chyle, and they deliver this stuff to the blood. Let me explain the why. No, well, a couple whys. The reason we're delivering this stuff to the blood, because we deliver all lymph to the blood, but we're going to send that off to the liver to be processed like we do with anything that we've absorbed off of the intestines. The other thing I wanted to explain is we call it lacteals, like lactation, like milk. The reason why is that all those little drops of fat will give those most lymph capillaries have lymph inside that's clear straw color. It looks a heck of a lot like blood plasma. Why? Because it's pretty much reabsorbed blood plasma. The lacteals, though, their lymph inside of them is milky and white because it's full of a bunch of little droplets of fat that make it cloudy. And so it looked kind of milky, and then so they called them lacteals, like lactation. It's just people stretching to find a word to describe what they're seeing. Anyway, moving on. All right, so you understand blind tubes, you understand endothelial cells being all there is. You understand they're attached on one side only, and that makes a flap-like mini valve. When we get to bigger vessels, bigger lymphatic vessels, it says lymph capillaries drain into increasingly larger vessels called collecting lymph vessels. These are going to be collected into vessels, trunks, ducts. The ducts are really big. You're going to have two ducts, but we'll get to that. So they have structures and tunics layers similar to veins, except they have even thinner valves. They have even more thinner walls. They have even more valves. Totally makes sense because they have even lower pressure. and they anastomose more frequently. Remember how I said that the anastomoses were more common in veins than in arteries, because veins were at lower pressure? Well, surprise, surprise. Again, we are at even lower pressure than the veins, so we're going to have even more places where these vessels come together, more anastomoses. All right. So the collecting vessels in the skin will travel with the superficial veins, but anything going along deep vessels in the body, they travel with the arteries. Don't know why, just know that's the way it is, and it's a good thing to know. It's one of those easy true false type question things, so know that. Moving on. Okay, lymphatics, the vessels join together to form trunks. Think like the pulmonary trunk is bigger than most of the pulmonary vessels. Yeah, that type of thing. So trunk is bigger. That's where joining up with the largest vessels. They drain big parts of the body, and they're named for where they are. So remember your regional terms of the body from AP1: lumbar, axial, stuff like that. But we have most of them are paired, and the exception to that is the intestinal trunk. We have one trunk draining the lacteals off the intestines, but we have two jugular trunks, two subclavian trunks, two lumbar trunks, two bronchiomediastinal trunks. So lymph from the trunks goes into one of the two ducts. Like I said, we have two. We have the thoracic duct that drains almost the entire body. And then we have the right lymphatic duct, which drains the right arm and right side of the head, right side of the thorax. So basically above the diaphragm and off to the right side, that's drained by the right lymphatic duct. Everything else by the thoracic duct. Both of those are going to empty the lymph they carry back into the veins, the venous side of the blood, where the internal jugular vein and the subclavian vein are coming together. So, all right, moving on. And there's a pretty picture of it going down, diagram of what it looks like. Fine with that. Yes, you'll need to know the two ducts. So, and here we go. Here we have lymph nodes. We're going to talk about those a lot of diagrams coming up. The nodes, again, are named for the regions of the body. So the ones in the armpit are the axillary nodes, the ones in the neck are the cervical nodes. Those are probably the ones your doctor's going to be feeling for first if they think you have infection. The ones in the groin are the inguinal nodes. I mean, you know these are the names you learned in AP1. All right, lymphangitis. If your lymph vessels get inflamed and you have these red lines under the skin, inflammation of larger lymphatic vessels contain vasa vasorum. They can get congested with blood. Again, we're talking vessels of the vessel. Larger lymphatics, like blood vessels, receive nutrients from branching vasa vasorum. So, in other words, remember I said that if you have a really huge vessel, like the aorta, it's going to have its own set of blood vessels, just like the heart has its own set of blood vessels. Some of these lymph ducts are big enough. Sorry, some of these lymphatic structures, I've covered myself, thus whether it's a duct or a trunk. Yeah. But some of them are big enough, they have their own set of blood vessels to feed those endothelial cells and nourish them. Okay, so lymph is a low pressure system like the veins, only even lower. It's propelled through the same mechanisms: the skeletal pump, the skeletal muscle pump, the respiratory pump, valves to stop it from flowing back, pulsations of the artery. As an artery swells because blood is going through it, that swelling artery is going to be pushing against the the lymphatic, and that will propel things through the lymphatic system. Um, Contractions of the smooth muscle walls of lymphatics, super important for things like the intestine, but also anywhere that you have like next to a large vessel where you're doing a lot of vasodilation, vasoconstriction, same possibility. Physical activity increases the flow of lymph. Immobilization of an area keeps needed inflammatory material in the area for faster healing. Yeah, but it also promotes edema. So if someone has edema, that's why you need to have them get out and exercise, get out and walk. It doesn't matter if it hurts. They need to be able to pump that lymph off. Either that or the doctor's going to throw them on a diuretic because they're going to be peeing every 5 minutes. But you got to reduce the fluid somehow. Moving on. All right, lymphedema, severe localized edema. I think we're discussing that, caused by anything that prevents the normal return of lymph to the blood. If you have tumors that are blocking the lymphatics, or if some of them were removed during cancer surgery, remember, we just said that if someone has cancer, the doctor is probably going to take out some lymph nodes, just to avoid having a passageway where the cancer cells can move. Anyway, lymphedema could improve if you have some lymphatic pathways remain and they enlarge. All right, so let's talk about different types of lymphoid cells, tissues, organs, all that jazz. Lymphoid cells consist of immune cells found in lymphoid tissue and the things that support them. So we got a couple slides here. We're going to do the immune cells, and then we're going to do the support cells. All right. So remember, never let monkeys eat bananas. Well, neutrophils, lymphocytes. So lymphocytes are a really common type of blood cell. The second most common type of red blood cell. And they are part of our adaptive immune system, the part that remembers when something goes bad and remembers invaders that you might have to fight. And these lymphocytes are going to grow up into two types, T cells and B cells. And they're named for where they grow up and become immunocompetent. The B cells do this in the bone marrow, and the T cells do this in the thymus. But the T could also remind you of the word traveling, because T cells are more likely to go roaming through the body looking for problems. Both T cells and B cells have specialized strains that are called memory cells, and that's cool. But the B memory cells are really famous because one of the types of cells they produce are plasma cells, which are basically antibody factories, the antibodies that help your body defend itself. So, but we'll get into that. Okay, so your immune system cells, T cells and B cells, protect against antigens. Remember, an antigen is anything that can generate an immune response, meaning convince your body that that doesn't belong. An antibody is part of the body's immune system. The antibody not only belongs, it helps you fight. So, in fact, the comparison I always use is if you think in science fiction, some little hunter-seeker probe that you put out um, is floating along. Like Star Wars, when Darth Maul released those little probes that floated around Tatooine looking for Anakins. Well, you have that. Those are antibodies, okay? Antibodies are floating around in your body looking for antigens, like Anakins, things that don't belong. And it will find them, and then it will call for the white blood cells to come and deal with the problem. Anyway, but so T cells and B cells are going to try to help us fight anything that has antigens on the surface, molecules that make it look foreign. We're talking about bacteria, toxins, viruses, red blood cells of the wrong type, the ones that don't match the type that you're supposed to have in your body. Cancer cells. Yes, there's an ability to fight cancer cells. Cytotoxic T cells are a cell, it's all in the name, cytotoxic, cell poisoning. You have T cells that, if they can recognize that a cell is cancerous, they will hunt and kill your cancers. A huge part of modern cancer treatment is immunotherapy, where they are trying to ramp up your immune system's ability to recognize and destroy cancers. If you can do that, it is a huge improvement over the old method of give people lots of radiation, give people lots of chemotherapy, and well, yeah, we killed the cancer, but we destroyed their quality of life on the way too, because we left them so sick. Anyway, so T cells will manage the immune response. Think of them as like generals. Some also attack and destroy infected cells. I just gave you an example of a cytotoxic T cell hunting cancers. B cells, they make the plasma cells. Those are the antibody factories. Um, Antibodies mark antigens for destruction. In other words, if an antibody is floating around and it sees something that doesn't belong, it grabs onto it, and it will even release a trail of chemicals saying, "Hey, I found one. Come here, get it." All right. So immune system continues. Here we have they're talking about other things besides lymphocytes that are in the lymphatic tissue. So we had our B and our T lymphocytes. Now we're going to talk about macrophages. You may remember, never let monkeys, okay? The M was a monocyte. Well, a monocyte is a baby white blood cell that will grow up to be a macrophage. Macro, big, phage, eater. This is Pac-Man. Walk, 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 walk. It goes along, it finds bacteria, it eats them up. Okay, that type of thing. So they are big eaters. They are phagocytizers. They also will present pieces of what they eat to T cells to say, "Hey, hey, hey, wake up! We need fight. We need to fight. We need to fight." So we have that, and then we have other antigen-presenting cells, dendritic cells. They will capture antigens, things that don't belong, and they will deliver them to the lymph nodes. Like, here, look, look, I'm in your face with the thing. It exists and it needs to be dealt with. So that's what dendritic cells are doing. Let's see. We also have support cells, reticular cells, and they make these fibers across the lymph node. In the lymph node, you're going to find open spaces called stroma, and then you have fibers growing across them. This is not that, but this is the comparison, the analogy that I always use. What you're looking at is a picture of from the sci-fi movie Independence Day. You see these fibers, these are actually steel structural girders, and every lump on one of those is a fighter UFO, like the alien version of a fighter plane. That's where it attaches and sits, is on that girder. Well, the reason I mention that, if you look at the next slide, this is an electron micrograph. This is the inside of a lymph node, and those reticular fibers are made by reticular cells, and they have living on them, sitting there, lymphocytes that are waiting for something bad to go by, and then they'll jump off and attack it. So pretty cool. All right, anyway. So reticular cells make reticular fibers, and they cross this space called the stroma. The stroma is network-like scaffolding where we attach immune cells. We got that. There are a lot of functions of lymphoid tissue. This is where lymphocytes live and hang out. This also is like an early warning system. This is a spot where you can do surveillance at different spots in the body, looking looking for things that need to be attacked, and cluing the lymphocytes and the macrophages in that there's a problem. as the lymph goes through the lymph node, goes through the stroma, it passes lots of white blood cells, and they just sit there like, yeah. Oh, wait a minute, that doesn't belong. So this is mostly made, like we said, of reticular connective tissue, which is a loose connective tissue. You have a lot of macrophages living on the reticular tissue. You see right here, right here, right here. Okay, the spaces between the fibers, it says, is a place for lymphocytes to occupy when they return from patrolling the body. That's especially T lymphocytes. Remember, the T, you could say, is for traveling. It's also for thymus, which is where they mature and become immunocompetent. But it's for traveling because they move through the body more than, say, the B cells do. All right, so there are different types of lymphatic tissue. We have diffuse and follicular. Let's talk about the diffuse first. All right. So diffuse lymphoid tissue is a loose arrangement of lymphatic cells and reticular fibers. You have this in almost every organ. You have big collections in the mucous membranes. Yeah, these lymphatic vessels going everywhere. If we have a bigger collection and we put a capsule around it, it's a lymphoid follicle, a nodule. These are more tightly packed, a lot more reticular fibers. They tend to be kind of spherical shaped or bean shaped. They have germinal centers. Germ tells you something's growing there. What's growing there? B cells are growing there. And they may form part of bigger lymphoid organs. That would be a lymph node. So lymphoid follicles could be just spread out as like Peyer's patches and in the appendix and in the mucosa, like we talked about before, or they could be collected up together, and then you put a nice connective tissue capsule around it and put some trabecula going in, and that would be a lymph node. All right. So lymphoid organs, we have two. We group them into either the primary, which are places where the T and B cells mature. We're talking thymus, we're talking the bone marrow. Or secondary, which is where the mature lymphocytes actually find an antigen they have to fight or remember how to fight. So T cells and B cells form in the bone marrow, like all your blood cells. But the B cells are the ones that grow up there. The T cells travel to the thymus and they grow up in the thymus. So T for thymus. The secondary lymphoid, the places where they might find an antigen that they have to learn how to fight or remember how to fight if they do already. Your lymph nodes, your spleen, mucosa associated lymphoid tissue. Remember, most organs have that diffuse lymphoid tissue. So here's a picture. You're going to see this picture multiple times, but it shows things like your tonsils, things like your thymus, your bone marrow, your spleen, your tiny little appendix down here, Peyer's patches, which are just collections of little lymphoid nodules that are in the small intestine. Why? Because you're bringing in all kinds of stuff from the outside and passing it through the body. If you bring in something bad, something toxic, something dangerous, it would be good to have some sentries, some checkpoints that are watching as things go by to make sure nothing bad came in. That's your place right there. All right, so lymph nodes are the principal secondary lymphoid organs in the body. Fancy way of saying they're the main area where you detect antigens. You have hundreds of these nodes around the body. Most of them are deep in connective tissue, in clusters around lymphoid vessels. Some are closer to the body surface. These are the ones that tend to be easy to find, and they're named. We're talking about the inguinal, the axillary, the cervical. They're in places where the collecting vessels come together to form trunks. And so, yeah, I would say this picture here, figure 23, know it. Uh, be able to identify where those vessels are. I mean, where those nodes are, what their names are. All right, so what are the main functions of lymph nodes? Cleaning the lymph, acting like a filter. What that means is you have lots of white blood cells there that are eating bacteria and stuff that go by. So macrophages remove and destroy the microorganisms that enter the lymph. They stop unwanted stuff from being delivered to the blood. Great, that's one function. Another one is immune system activation. This is a place where lymphocytes can become activated and mount an attack against antigens. So I really don't like that they broke this into two functions, because um, part one, function one, doesn't happen without function two. Function two is kind of happening in the middle of function one there. What I mean is we're passing the lymph through the lymph node to find and destroy things that don't belong. Well, as that happens, the way we do this, we wake up the white blood cells, we wake up the lymphocytes, like, oh, it's that, yeah, I know how to fight that. Or, oh, I don't know how to fight that, but he does. You get in there. All right. Anyway, so our lymph nodes vary in shape and size. Most are shaped a little bit like a bean or a kidney. What we mean is, oh yeah, it's kind of oval rounded, but it's got a convex outside and a little concave inner here with a notch. That notch would be what we would call the hilus. Anyway, oh, by the way, you're going to see the same term on the kidney. That's why I compare them in shape and naming to the kidney. And again, just like the kidney, we're going to have names for the outside, the inside parts. The outer layer here is the cortex, and the inner layer here in the middle is the medulla. The M in medulla should remind you of the word middle. The middle of the lymph organ, the middle of the kidney, the middle of hell, your brain, the middle of so many organs. Or you're again and again and again, you're going to see cortex and medulla. In this chapter, you're going to see it again in thymus. But the cortex is the outer layer, and the medulla is the inner layer. And you can see the cortex has these lymph nodules with these germinal centers, so we're going to grow lots of white blood cells. And the medulla, we have the medullary sinuses, and this is a place where we're passing lymph through the vessel. And the lymph, we talked about how, oh, we scan it when it goes through the vessel. That's where that's happening. Medullary cords, medullary sinuses. All right, so the cortex, the outer layer, has the follicles with the germinal centers that have lots and lots of B cells. That's the superficial cortex, the outermost layer of this outer layer. The slightly deeper, it's still in the cortex, but it is not right at the surface by the capsule. If I didn't mention it yet, there's a capsule, there's a connective tissue layer around this whole thing, keeping it intact and nice big lump. And there are little walls coming in from it that are called trabecula. So here we have a capsule, and here we have a trabecula diving in through the cortex. In fact, I think that's where they draw the definition of cortex and medulla. If you got trabecula, you're in cortex. Anyway, the deep cortex is where the T cells are traveling, transit. T cells are circulating around the blood, the lymph nodes, the lymph. T cells are always on the move. Think of a cop walking a beat looking for problem bacteria that need to be destroyed. You have lots of dendritic cells. Remember, those are antigen presenting cells. They will activate T lymphocytes, they will activate B lymphocytes. How? They take a piece of an antigen or a whole antigen and they say, look at this, doesn't this look suspicious? Think of them as the paid informants for the cop. All right, so The middle, the medulla, the medullary cords are coming from the cortex. And these medullary cords have B cells, they have T cells, and they have plasma cells. Remember, plasma cells are made by B cells. A B cell, if it's activated, will divide in half. One daughter cell stays as a memory B cell. I should say a memory B cell, if it's activated, will divide in half. One daughter cell will stay a memory B cell. The other one will grow up to be a plasma cell, which is an antibody factory. All right, so we also have lymph sinuses. Here we have a subcapsular sinus. Remember I said you have a capsule with trabecula? Here's this connective tissue capsule. Here's the connective tissue trabecula that comes down. But below that capsule, you've got a space here. That's the subcapsular space. And that is subcapsular sinus. Sinus is a space. And that is one of the places that you could have fluid passing through. But more of it's going to go through the middle here. The medullary sinuses in the medullary area, those spaces are full of lymph. And those are the places that have those reticular fibers we were talking about, with the macrophages living on them, ready to jump off and do battle with invading pathogens of whatever type. Anyway, so yeah, macrophages live on the fibers in the medullary lymph sinuses. So let's move on. Okay. I want you to learn the words afferent and efferent. You're going to see these again and again. A and afferent should remind you this is where something arrives. You should already know these terms because they're the same terms we used in the nervous system in AP1. If you remember, there was an afferent signal that arrived at the central nervous system, and there was an efferent signal that exited the central nervous system and went out to a muscle somewhere or something. So in the same way, an afferent vessel makes lymph arrive at the lymph node. Those are the ones on the convex outer surface. So here you have two labeled afferent vessels. It's not labeled, but here you have another afferent vessel. Anything that is making the lymph arrive at the lymph node is afferent. Now, these two here at the hilus, they are draining the lymphatics, the lymph node. Anything that drains the lymph node carries carries lymph away from the lymph node. It makes lymph exit the lymph node. And that exit is why you should remember the term efferent. The E in exit should remind you of the E in efferent. And again, you're going to see these terms again. You've already seen them once before in AP1. We did the nervous system, but you're going to see it say in the kidneys when we talk about arterioles carrying blood to and from the glomerulus. The blood is going to arrive through the afferent, it's going to exit through the efferent. So, yeah, moving on. So another homeostatic imbalance. If you have swollen, inflamed, tender lymph nodes because they're overwhelmed by the bacteria or whatever they're trying to destroy, we call those bulbos. This is a swollen gland. Sometimes they're even swollen with pus. That would suck. Bubonic plague was named after the bulbos that were being caused. All your lymph nodes would swell up with as they're trying to make enough white blood cells to fight the horrible that's coming. All right. Lymph nodes can become secondary cancer sites if a cancer metastasizes. Like if you have this cancer and it spreads to somewhere else in the body, the way it's going to spread may be the lymphatic system. And if it does, that's really bad, because if it becomes a secondary site, in other words, if you form a tumor in that lymphatic system, it's going to send off pieces to all over the body through the lymphatic system. So cancer infiltrated lymph nodes, swollen but not usually painful. That helps to distinguish cancerous lymph nodes from infected lymph nodes. So if a doctor's poking here and it hurts, be thankful, because if they're poking here and it doesn't hurt, that's bad. All right, moving on. Okay, the spleen. What I have here is a picture of a SOMSO model of a pancreas and a spleen, and you can see there next to the duodenum, the first section of the small intestine. Don't worry, when we do digestive system, you'll learn them all the sections. But this thing here is the spleen. Let me jump back. You can see that it's kind of hiding underneath the left side of the liver and behind the stomach a little bit, wrapped around it maybe. That spleen is a super important lymph organ. Okay. So blood rich, has tons of blood vessels. I would like to say has a maze of twisty little capillaries all alike. It's about the size of a fist. Left abdominal cavity below the stomach. It is your biggest lymph organ. It has the splenic artery that delivers it blood, and a splenic vein which draws the blood away. Again, it's kidney-ish, as a convex surface and then a concave surface, and in the middle of the concave surface we call the hilum. That's what they're talking about. That's where the blood vessels come in and go. What's happening here, you have two functions. There's a lymphatic function, which is making lots of lymphocytes and immune response, lymphocytes looking for problems. And then we have a totally different function for blood, and that is to remove old red blood cells that are wearing out as they get older. You want to do that before they get so old and inflexible that they have trouble and get stuck in tissues and kill the tissues. So how do we do this? We force those red blood cells through lots of little passages, twisty, in the spleen. And if they get caught there, the spleen can deal with them where normal tissues can't. We'll get into that. All right, so here's this picture again. And I left it in so you can see where the spleen was. Here is a diagram of the spleen that's opened up. Remember, the hilum or hilus is where the vessels are coming in and out. All right. What's not showing here, but is on the next slide, is the red pulp, white pulp thing. I'll cut to the chase and tell you. White pulp is involved in immune system. Red pulp, red reminds you of blood. Red pulp is the blood filtering, removing of old red blood cells stuff. All right, so there we have the diaphragm, the thin, this is a photo of an actual dissection. This is the thin layer of muscle that is above the liver, above the stomach, and below the lungs. All right. And right there, brushed up against it, we have the spleen. It's real close to, you can see here we have a piece of the left kidney. Here we have the adrenal gland that sits like a hat on top of the kidney. Well, the spleen is right in that area too. Okay. And remember, you saw this picture with the spleen being next to the pancreas. Well, it is. Here's your spleen, and here's your pancreas. All right. Moving on. So, three functions of the spleen. We actually, hold on for just a second. Okay, so let's jump back into that. I already told you that the spleen is where red blood cells go to die. So let's build on that here. When the red blood cells die there, we're actually going to store some of the breakdown, the stuff that we get out of the red blood cells. Like iron is precious. Iron's hard to get, so we keep pieces of that heme group. Another function of the spleen, it will store platelets and monocytes, remember future macrophages, to release into the blood when needed. And what that means is if there's a cut and, oh, wow, we need platelets, it'll dump them in at that time. Like, oh, here, have more. And we think this may also be a location where in the fetus or the infant, we make red blood cells. So the spleen is wrapped in a fibrous capsule, has trabecula that should sound a lot like the lymph nodes. It is, it's just bigger. Histologically, we got two parts, the white pulp, the red pulp. White pulp tends to be immunology functions, and red pulp tends to involve blood. So let's move on here. So the white pulp is white because it's full of mostly lymphocytes. We have this around central arteries, and if you look at a slide of, like you see here, of the spleen, you will see what they are calling islands of white pulp in a sea of red pulp. That's important. That's a good way for you to remember that it is mostly red pulp. So the red pulp is where old red blood cells are destroyed, pathogens are destroyed. Has lots of red blood cells, lots of macrophages that are eating old worn out red blood cells. It has splenic cords or reticular tissue. Again, this should sound a lot like a lymph node that separate blood-filled sinusoids. Okay, great. The spleen has a thin capsule. We're doing the homeostatic imbalance. So a severe infection could rupture it. Someone could punch you in the spleen. If this happens, you're bleeding out. So this is bad because it's full of blood. So a splenectomy is how they would remove the ruptured spleen. And we used to think that was pretty standard, the way to go. Obviously, you can't let someone bleed out internally and die, so hemorrhage and shock. But we now know that the spleen can repair itself from some damage anyway. So emergency removal of spleen, that's less likely than it used to be. If the spleen has to be removed, then the liver and bone marrow have to be able to take over its functions. If someone's younger than 12, their spleen has all the stuff inside still to regenerate and grow back, if at least some of it is there. All right, so now we're going to talk about MALT, mucosa-associated lymphoid tissue. You're going to need to know what the abbreviation stands for. You're going to need to know the three things that are considered to be MALT. And those are your tonsils, your Peyer's patches, which are kind of like tonsils of the intestine, and your appendix. Anyway, MALT is lymphoid tissue in the mucous membranes. That's why mucosa associated. They're not in big thick lumps like lymph nodes. These are little tiny collections, a lot of times without a capsule around them. Anyway, these are early warning sentry sites for bacteria and nasty things trying to get into your body. We find them in the respiratory tracts, in the digestive tracts, genital or urinary organs. Excuse me. And we already said the three things that you're gonna need to know for MALT in this class are the tonsils, the Peyer's patches, and the appendix. So tonsils are the simplest of our lymphoid organs. It's a ring of lymphatic tissue around the pharynx. They might look like swellings. They're named where they're located, the palatine tonsil, each side of the soft palate at the back of the roof of the mouth. The lingual tonsil, lingual is like tongue, so base of the tongue. Pharyngeal, I also call those adenoids. Those are the back of the nasopharynx, so above the palatine tonsils. And tubal tonsils surround the auditory tubes into the pharynx. We usually call those eustachian tubes, but yeah, we have those eustachian tubes. And there are tonsils around them to control any nasty stuff that tries to go up the tube and get into the inner ear. All right, so when you look at a tonsil, its job is to gather or remove pathogens from food and air. It samples the stuff that's going by. It's got a bunch of follicles with germinal centers inside. Again, this is lymphatic tissue. It sounds a lot like a lymph node so far. Scattered lymphocytes, again, like a lymph node, but not as much not as many lymphocytes, and not fully encapsulated. It doesn't have a full capsule like a lymph node would. The overlying epithelium has lots of little grooves or canyons going down into it. We call these the crypts, okay? And these tonsillar crypts, food, bacteria, they can get caught in there where they're trapped and destroyed by the lymphocytes. But if you let the immune cells, the idea is that you want to know something's coming by, and the immune cells get activated. They your memory B cells are going to be created so they can remember, hey, that thing that went by, watch for it, that wasn't good. But the problem is those crypts can get clogged with nastiness sometimes, and I'm sure that's coming up. But all right, Peyer's patches are the same idea, collections of lymphatic tissue, but even smaller, and these are embedded in the wall of the distal end of the small intestine. When I say the distal end, they're talking down near the, remember we have the duodenum. Well, you don't know yet. We haven't done this yet, but in digestive, the small intestine is divided into the duodenum, the jejunum, the ileum. So distal portion would probably be in the ileum. Anyway, structurally, they're a lot like tonsils. They got crypts. They sample what's going by. They destroy any bacteria they find. And that prevents the bacteria from breaking through the wall of the intestine into the rest of your body. And it also generates memory lymphocytes. Now you have T lymphocytes, you have B lymphocytes. People talk more about the B ones because those are the ones that'll make the plasma cells, the antibody factors, but they're also memory T cells. All right, let's move on. The appendix. Okay, this is, I am going to go through digestive system really quick for you. Stomach, and then we go through the pyloric sphincter, the valve at the end of the stomach that controls what goes into the small intestine. Then we go through the duodenum, the jejunum, the ileum. Those are the three parts of the small intestine. We're now ready to go into the large intestine, but there's a valve there, the ileocecal valve. It's named because it's the valve between the ileum and the cecum. So duodenum, jejunum, ileum. The ileum is the last part. The last of the three parts of the small intestine. And then you got this valve. And on the other side of it, you have the large intestine and the cecum. Now in us, the cecum is reduced to this little tiny appendix. In fact, the full name of the appendix would be the vermiform appendix. Vermiform means in the image of the worm, the little tiny, in the form of the worm, that little tiny thing. But in some animals, like a horse or a rabbit, the cecum is this enormous thing, bigger than the stomach can be sometimes. I mean, it depends on the species, but yeah, the cecum is a huge deal in some species. In us, it's almost like a afterthought. But the cecum is a little piece of the large intestine. And then the large intestine is the colon. You have the ascending colon, the transverse colon, the descending colon, the sigmoid colon. Yeah, okay. But the ileocecal valve is named because it is between the ileum, the end of the small intestine, and the cecum, which is part of an extension of the large intestine. And in us, we call that little cecum the appendix. All right. So there's a lot of lymphoid follicles going on there. And it acts like Peyer's patches. It destroys bacteria. It prevents them from busting across the wall of the intestine, and it makes a lot of those same memory lymphocytes, B and T memory cells. All right, so the thymus, we already said that's where the T cells are going to grow up. So it is a bilobed. That means you can see it's divided into two pieces. If you look at the next picture, you can see it better. Two lobes. Okay. So bilobed lymphatic organ in the inferior neck, the lower part of the neck, and it extends into the mediastinum, the space in the middle of the chest, and partially covers the heart. It'll get smaller over time as you grow, as you mature, but it functions as a lymphoid organ where T cells grow up, T cells mature. That's why T cell thymus works really well. A nice pneumatic device, and yeah, nice mnemonic device. That's why I put the T in red and the T cells in red. So it's most active and it's biggest in childhood. Like I said, it'll get smaller as you grow up. It will atrophy. It stops growing in adolescence, then it atrophies. It still produces immunocompetent cells, but it does it a lot slower. Okay, so that's good. We don't lose the T cell function, the thymus functionality entirely. We can still grow new T cells. But those lobes are divided into lobules, and those lobules have, here I told you you'd see it again, a cortex, that's the outer layer, and a medulla, that medullary part is the middle. The cortex has lots of dividing lymphocytes. Those are what most of the thymus cells are, and a few macrophages. The medulla has fewer lymphocytes, fewer corpuscles, but this is where the regulatory T cells are developing. Just like I said, you have memory T cells and you have cytotoxic T cells. You have regulatory T cells. These are like the generals that tell other types of white blood cells what to do. So regulatory T cells, a type of T cell that helps prevent autoimmunity. We want to stop them from attacking each other. If someone has autoimmune disorders, they've got a problem with regulatory T cells. All right, so the thymus differs from other lymphatic organs in 3 ways. 2 of them are on this slide, 1 of them's on the next. So let's jump in. It doesn't have any follicles. Why? Because follicles are where B cells grow up. That's a B cell thing, and this is a T cell organ. So no follicles. Also, the thymus doesn't directly fight antigens. It's not scanning for stuff that doesn't belong and jumping into action, none of that. It is strictly a place where the T cells grow up. You even have a blood thymus barrier to keep the immature cells from being exposed to antigens too early. You know, kind of like the Jedi are not, they're going to protect the Padawans until they are old enough and good enough at fighting that you can say, and this is the thing you must attack. Same way. We're going to protect the growing T cells until they're mature. Then we will activate them, probably in the lymph nodes. All right. So a third way that it differs. The stroma is epithelial cells, but it doesn't have reticular fibers. Remember, in the lymph node, we had a lot of reticular fibers. We had a lot of macrophages hanging out there. We're not doing that because it's not an active area for attacking and hunting the antigens. So it provides a place where T lymphocytes grow up and become immunocompetent. Great. All right, here's that table. Remember I said when we got towards the end, there'd be this table and you would need to memorize it, and it would be called table 21. This is it. So you'll need to know it. The only thing left that we're going to talk about here is a couple slides on development. So the beginning of the lymphatic vessels, clusters of lymph nodes, is seen in an embryo by week 5. They start out as little lymphatic sacs that are attached to the developing veins. The jugular lymph sacs, they were going to form the lymphatic duct and the thoracic duct, which makes sense because you remember they're going to those two ducts, when they're mature, they're going to empty the lymph into the venous system at the jugular veins, the junction of the jugular and carotid veins. Anyway, these lymphatic organs, except the thymus, they're all mesoderm based, or mesoderm, the middle of the 3 layers that make up the developing baby. Lymphatic organs, except the thymus, develop from mesodermal mesenchymal cells. The thymus is endoderm, the inner layer, because it is an outgrowth of the tube going through the body. It's an outgrowth of the pharynx, which is part of the GI tract. Excuse me. But we have spleens and tonsils that are a little different, but most of the lymphoid organs are not well developed at birth. The spleen is pretty well developed. The tonsils are pretty well developed. At birth, you have a whole bunch of lymphocytes appear, and they develop along with the rest of the immune system, which we're about to talk about. And that is the end of this PowerPoint. All right, let's wrap this one up.